We are together in person, live from Miami.
I know. I can't believe it.
I know. It's super surreal. Like, I don't even remember the last time we saw each other in person.
Oh my God. It was the wedding. Ellis's wedding.
Was it really?
Yeah.
And that was October of
21.
21.
Yeah.
So it's been almost 2 years.
It's been 18 months since we've seen each other in person.
We see each other all the time, but definitely over
not like this.
Zoom. So we are gonna play Nurse Squad like live together tonight. So we are so excited, and we are so excited to have you guys join us too.
Yeah.
So
it's always, I mean, playing Nurse Squad like live together is always fun, but like I think it's way more fun when I can like give you trouble right here.
Totally. Well, we could do the smack talking like live.
And when we're using like the same deck, so like there's no like, oh, I've already seen this card, or you know, whatever.
Right.
It's gonna be so much fun.
Totally. So I hope we have, I don't know if for people joining us, if you've played before or not played before. How many of you guys have played with us before? We do this about every other week. We do different subjects. Meris Shuwarger. She is so beautiful.
Thank you.
She is so beautiful. And then for the people who think we are one person, now you for sure know that we are two distinct people.
Yes, and shockingly not related, which we get constantly.
Yeah, totally.
Yes, I'm very excited to go on this cruise and have people asking us all the time, like, are you sisters? And we're like, no.
Totally. I have. Okay, so Dee Dee, you thought we were like one person? Or you have played? No, I think she meant she's played before, not that she thought we were one person. We get a lot of that, though.
Yes, we do. Yeah.
I'm new to playing with you all. Glad to see you two together.
Yes, us too.
Never played. Okay, so lots of never played. So let's go through. So there's a number of things we're going to do tonight. So first of all, we're going to give away 2 Nurse Squad games tonight. Yes, because we are all about the giveaways. So we'll give one away about halfway through our live, and then we'll give another one away like towards the end of the live. Okay. And then the way we play this is we have like Team Cathy and Team Meris.
Yes.
Okay. And you guys are going to help answer questions for your team. So if your handle, oh, look, Meris on it. She's so on it. She's usually always in charge of like the banner and everything. And I get to just sit back and play. Now I get to see like behind the scenes. But okay. So if your handle is A through L, your username as it is displayed, then you are Team Cathy. And if your handle is M through Z, then you are Team Meris.
So tell us in the comments so that we can check you guys and make sure that we all understand. So Team Meris, you do not answer questions for Team Cathy. Don't help them out, make them struggle. Team Cathy, likewise, Team Meris doesn't need your help. So save the answers for Team Cathy, okay?
Totally. Okay, so that's how we divide the teams. Because people kind of join throughout the live, we will be repeating that. Actually, we'll probably leave the banner up, but we'll also remind people because people get really excited. So when you go to answer a question, first of all, make sure it's your team's turn to answer a question. And then second of all, don't use Google.
Yes, please don't. I mean, listen, we know you can answer. Google can answer everything. ChatGPT can answer everything, right? But this is to see how you can answer it and to pit our teams against each other. So don't use Google. It's against the spirit of the whole thing. So
totally. So do we have any other rules about answering questions? I think that's it. Yeah. We might yell at you if you answer for the other team, though, just a little bit.
You get a little scolded.
Exactly. Okay, so tonight we're playing our Pharmacology Nurse Squad game. So we have 8 games in all. Med-Surg, Pharm, Peds, maternity,
nutrition, health assessment, fundamentals,
and
psych.
Yeah, psychiatric mental health nursing. So we just rotate through them all. So tonight is going to be Pharmacology.
Yes.
And for those of you guys who have not played, this is our Nurse Squad game. When you open the box, I've already taken everything out, but there's like instructions to tell you how to play. There are avatars, so you can pick who you want to play as. So do you want to pick who?
See. I think I'm going to go with, I feel like Mia the mentor today. My girl in her space themed scrubs.
Nice. I'm going to keep it like I'm going with Izzy. Izzy's got the guns, so I'm.
Okay, did I tell you or did I tell you? I told you. If you've been to the previous lives, I have been hyping up the gun show for months now, and it has finally arrived.
It is here, right? So anyway, it is here. We're in Miami, so I have the tank top on now, right? Because it's been like cold.
Yeah.
Even in California, it's like chilly.
Yeah, it was 33 degrees when I left Ohio today, so I'm still in my like short sleeve shirt. I didn't get all the way to the tank top, but now we're here and it's so hot.
It is so warm and it's like humid too. We don't have this kind of humidity back where I live. So so we have 8 avatar cards, and then we have our I love the hazard cards for pharmacology.
For farmers, so good.
Totally. So every one of our Nurse Squad games has 8 hazard cards that are specific to that game.
Yep.
So I don't know, what's your favorite out of these ones,
So
Meris?
I love this one. This is order clarification, and Mia over here is like looking wildly confused with this order. And this is me anytime, and with all love and respect, but anytime a new resident puts in an order, I'm like, what? Like,
what would you like me to do here?
It'll be like PRN every 6 hours scheduled, and I'm like, no, those are opposite things. What is this?
Totally. Yeah, here's mine. So I wrong Pyxis. That was my life when I was on med surg, right?
Yes.
Like, and I worked on this bougie nice unit, but it was kind of like an airport terminal. And so everybody had like their own room and everything was super spread out.
Yeah.
I walked so many steps during a shift.
Oh yeah. It drives me insane because we have some things that are in all of our Pyxis and then some that are like only in certain ones.
Yes.
And then, so if I have somebody who's boarded in the ER, I'm doing the little runaround, going to all of the different ones. And then I have to call pharmacy. Can you send me this one? We don't stock it. Yeah. So I am persistently, poor Izzy there, trying to get her.
I know. I always did that. And then I had to go to the other Pyxis. That was a haul.
Mm-hmm.
It was like a half a mile this way.
To really get your steps in.
Totally. And then, of course, when I was a new grad, sometimes I wouldn't know all the different little places they might have put a prescription. God. So then I'm calling pharmacy and being like, my whatever's not here, right? And of course, sometimes it was there. And I just didn't know where to look as a...
CD said, I already passed farm, but I feel like I'm going to bomb this because I think I already forgot all about farm. Listen. That's why we're reviewing.
Totally.
You always got a chance to review, but also literally, CD, you've been here for like every single live we've ever done.
You're going to be just fine.
Remember when Cathy asked a question and I was like, oh my God, I have no idea. It's okay because in the real world, you can look those things up.
Totally. And nobody can remember all the things.
No.
And honestly, in nursing school, it's kind of ridiculous how much stuff they expect you to know for random stuff. Cause I'm I've been working on our peds videos for for GI and developmental dysplasia of the hip and Pavlik harness teaching. And you have to know that Pavlik harness teaching, but really in reality, do we need every nursing student to know everything about Pavlik harness teaching? No, but you have to know it.
That's just I'm so glad that now the new NCLEX is giving laboratory ranges because
that's real world.
But in the real world, the second I pull up their labs, it tells me if it's high or low. I don't have to retain that information. Oh, that's infuriating.
So I love that they're doing that.
Me too.
And I feel like everybody who's freaking out about the new NCLEX, I'm like, it's better. You don't have to know the lab ranges. You get partial credit on multiple choice questions and things. I think it's way better. Yeah. I would have rather have had the new version when I took the NCLEX.
I also think I took the pilot questions when I took my NCLEX 2 years ago. And when I was doing it, I was like, this is a lot more obvious. I don't know how to put it, but going through the charts and seeing and then being like, what is this patient at risk for? I was like, well, it's pretty clear now versus trying to add 150 things to a question that I shouldn't be adding anything to,
That's true. Because when you have this question in isolation, you're well, it depends. It depends if this is going on or if this is going on. So the case study is a little more robust and gives you the information you actually need.
Yes, exactly.
To answer the question.
Exactly. Yeah.
And our resources can help you know all of that core information you need to know so that you can answer those questions.
Exactly. Because
for
that
sure.
content isn't changing at all. It's
Totally.
just your ability to apply it to a different scenario. But I really think it's a better scenario.
Totally. So the other thing in the Nurse Squad game are the question cards. So Farm has this many question cards. It's pretty beefy. And each question card actually has 2 questions. So you actually have this many review questions. And you can play with a huge group. You can play with a small group. You can just review questions on your own if you want to.
Oh yeah, we have ways for you to play. So we have, when you take the instructions out of the box, it will tell you our suggested gameplay rules for 2 to 4 players, I believe. But there's a QR code on there that if you scan it, will take you to alternate gameplay instructions. And we have it for like how to gamify it for yourself, to play by yourself, how to play, you know, in small groups, big groups, classroom settings, etc. How to play collaboratively versus like PvP,
like the way we play competitively. One day maybe we'll play collaboratively, but I don't know. So, but you don't have to play cutthroat like we do.
No.
And by the way, I did not bring the trophy. Like with packing luggage, I'm like, it didn't make the cut. It did not. But the timer did make the cut, so we can make sure everybody's answering within 1 minute when we answer questions. So that is how we play. So we're going to take turns. I forget who goes first this time, but I don't remember either. Basically the deck is shuffled. There's 1, 2, and 3 point questions. 1 point questions are easier. 3 point are harder. 2 are in the middle. And we don't know what question's going to come up next. Yep. So sometimes like who wins is definitely kind of luck of the draw as far as like the points. Yes. Because typically someone out in our audience usually knows the answer.
Oh yeah, there's only been like 2 times,
just a couple times where people have not been able to get an answer. Yep. We have some real smarty pants in the audience, and I won't list them. We have some regulars and who have all of our decks, who watch all of our videos. So guess what? They know all of their stuff. Yep. And they're going to kill their test. 100%. So they do good. And they're, luckily for you all, they're kind of evenly distributed amongst Team Cathy and Team Meris. Yes. So all this, anyway, so there will be people on your team to help you out if you're not quite sure of the answer. So, all right. So do you want me to ask you first?
Yes. All right, let's do it. Team Meris.
Okay. You guys ready? So if your handle is M through Z, this is your time to put the answer in the comments, okay?
A through L?
Yeah. So, okay, we have a nervous system question so these will all be pharmacology, but this is a nervous system medication question. It's worth 2 points. Okay. What is the antidote for cholinergic medications? Ooh. What is the antidote for a cholinergic medication?
Okay.
So maybe you want to give them some, thank you. Yes. You want to give them some examples of some cholinergic medications?
So cholinergic medications are going to cause some hallmark side effects. Let me see, a good one, donepezil is one, I think.
Is it, so a cholinergic, I don't think those are like myasthenia gravis medications, right? Those have those side effects.
There we go.
Oh, right out of the gate.
Atropine, yes.
Atropine.
So, cholinergic medication toxicity. We have a cholinergic crisis. We want to give an anti-cholinergic medication, right? And atropine is one of the strongest that we give. We give this in surgery to help manage secretions. We give this in end of life. It also has some other consequences.
Gets the heart rate
up. But yes, atropine, when you see trope in a drug like that, you need to be thinking strong anti-cholinergic.
Yeah. Nice. Bunch of people got atropine. So 2 points for Team Meris.
I love it.
Do you want to make a stack of your cards?
Yes.
Okay. All right, Team Cathy, it's our turn. If your handle is A through L, so that includes UCD, so listen. I don't mean to call out CD, but I just want to make sure CD's listening. Go ahead.
What dietary teaching should the nurse provide to a patient taking phenelzine?
Okay, there's a rhyme. And I can't give you the rhyme, but if you have listened to our videos about this medication, so can I say what class of medication it's in? No. Okay.
There we go.
Woo-hoo! no tyramines.
You guys are too
so
smart.
with phenylzine, you can't enjoy life's finer things because they contain tyramines. So that's the rhyme. And by finer things, we have stuff like aged cheese, salami, chocolate, and red wine, like all the yummy things.
And then like weird things too, like avocados and bananas.
But those are yummy too.
I know, but I'm like,
they're not like maybe.
I'm always like,
fine
I always
things,
forget about those because I'm trying to live the high life here with my like smoked and aged meats and cheeses, and then they're
maybe
like,
we
"And
should eat
bananas."
some of those tonight.
We
We
should.
So after this, we're going to dinner
Yep.
with our husbands, and
Yeah, and I'm not on an MAOI, so I plan to have all of life's finer things.
all of life's finer things are coming our way tonight. So
Oh, good.
way to go, Team
Yes,
Kathy.
we got it.
All right.
2 points.
2
So we're
points.
tied.
Okay. I now have a 2-point question for Team Meris. It's from the gastrointestinal system. Okay. For chemotherapy-induced nausea, when should antiemetics be administered?
Great question. Chemotherapy-related nausea. We know when chemotherapy is, right? Not like with other nausea,
Right.
when it's just random.
Right. So when do we need to give antiemetics? Yep. Before.
Yep.
You got to give it prior to chemotherapy. You want to get ahead of it and, give it as needed. You don't wait until they already are throwing up. You want to
Exactly.
kind of prevent it. So,
Yes.
all right. No, that's yours.
Oh, that's
Sorry.
mine. Yeah.
That's yours.
Thank
All
you.
right. Good job. Good job, Team
Ooh,
Meris.
we got a lot of nervous system questions in here.
Oh, did I not
Sorry.
mix it up
No,
right good?
we probably have just a lot of nervous system questions.
Yeah, there's that.
Oh, this is a great question. Okay. This is a 3-point nervous system question. 3 points. After how much time must unused portions of propofol be discarded?
Okay. Can I explain the rationale?
Absolutely.
Okay. So propofol has an increased risk for bacterial contamination. So we need to use it within X hours or we got to discard the remaining amount in the vial.
Yep.
So how many hours is that? Well, should I have said hours?
It's all right. I mean,
Okay. Well, now, yes, Jonathan,
6
good
hours.
job.
And now listen, every time I've ever posted about this on our social, people get really uppity with me about it because apparently it's different based on hanging infusions, like versus but I'm like, this is literally what the manufacturer says. Like, I don't know what to tell you.
Yeah, that's totally on the drug guide. Like it's
like,
it
comes
is.
from
And
the
this is what you're gonna
manufacturer.
get. That's what you're gonna get tested on too. in
Yeah,
nursing
so
school.
6 hours.
Yeah.
And that's like legit. I pay very close attention. I mean, typically we in the ER, we're just giving a bolus of propofol and then starting you on like the drip with a different canister. But that's one of those things where I will pay attention. I'll write down what time we, drew that up because I can still use that bottle, but only for 6 hours.
Okay.
Yep.
All right. Nice job, guys. Nice job. So I see lots of 6 hours. Okay.
Also, wait, I just have to.
Are you guys twins?
No relation, but we love the compliment.
Totally. We are not twins and we're not the same person.
No, yeah, 2 different people.
Twins like separated at like maybe like conjoined twin, right? we just tell people that from now on.
Yeah, we're twins. Yeah.
Totally. Okay.
Oh,
Good
God.
job. So that was so now
Yep.
it's your guys. Okay, so we do have a lot of
I know,
nervous
that sounds
system right
good.
there. All right, this is a 1-point nervous system.
Team Meris.
Okay, you got this. I'm expecting everybody to be able to get this.
It's a 1 point.
It's a 1-point
We got
question. Acetaminophen can be toxic to which organ?
Best friends. Come
Okay.
on. This is like Pharmacology 101. My husband, who's laying on the bed over here, can probably answer this too.
Do you know?
Do you know?
I didn't listen.
Okay,
Say
wait.
it again?
Don't answer it yet. Wait. We'll wait till they put it. Her husband has got a messed up back, and he's trying to be real quiet over there in our hotel room.
Yes.
Okay, now let's see if Jeff can get it.
Okay, Jeff. Tylenol.
Tylenol?
It's toxic to what organ?
I thought Tylenol was candy. Is it toxic to any organ?
You thought Tylenol was candy.
Oh my God.
You need to train your man up. What are you
Listen.
doing?
All right, if you're watching at home, here's your reminder that just because something is over the counter doesn't mean that it is safe.
Oh, wow. We're going to get my man
If
up
you
here to
had to
try to
pick-
answer some questions.
If you had to pick an organ,
The Tylenol is
Yes.
bad for liver.
yes,
Okay,
liver.
all right. He
we
came
got
through.
there. We got there eventually.
After we got over the Tylenol's not candy thing,
Yep.
then he
God.
said liver. So
You know, my dad was a doctor, and he, one of the things, like the hill that he would die on was that Tylenol being over the counter was one of the worst things to ever happen. And
more so
he-
than aspirin?
Yep, he felt like
Really?
Tylenol was like the thing. And I read some studies of like doctors like trying to get the FDA to like not clear it anymore, like, or at least to change the like prescribing information on it and stuff, because it's so bad for your liver. And people, I'm not naming any names, but people think that because it's over the counter, it's safe, and it's not.
See, I would think I've always heard that or just thought like aspirin.
Yeah.
Aspirin is something it's a little crazy that's over the counter.
Yeah, especially given the fact that
Side effects
yeah.
and the thinning of the blood and everything. Like it's kind of crazy.
I know.
So
it is.
all right,
Right.
so Team Cathy. So just as a reminder, if your handle is A through L, you're Team Cathy, which means you're going to answer this question here that Meris is
I'm
about
just
to
gonna put
ask.
this little nervous system question.
Yeah,
away,
mix it up a
'cause-
little more. You saw me?
No, I know.
I mixed them. Anyway,
Somebody has a guilty conscience.
I know, like how a nervous system. Okay, so Team Cathy, this is our question.
Oh, this is a 2-point respiratory question, but this is so easy that I feel like it should be a 1 point.
All right.
A normal finding of acetylcysteine is that it has an odor similar to what?
Okay, what does acetylcysteine smell like? And then I'll give you the little rated PG-13.
Oh,
I know. You're
Did
not
I
the
know
only
this
one with the nasty little hints for remembering stuff.
I don't know if I know this one.
Well, it's really not that.
Oh, okay.
It's not really that dirty, so maybe it didn't, Okay, what? Yes,
Yes.
rotten eggs. Very nice, very nice. Okay, so at this point, what is what's our point total?
Oh.
I'm wondering. Oh wait, it's your turn to answer a
5
question.
points. No, we just completed a round. I answered, then you answered.
Okay, you ready? This is for Team Meris. Infliximab neutralizes the which cytokine to decrease inflammation?
You're making this up.
Okay. Okay, I thought it might take a little longer before you realized I made that up.
You said infliximab, and I was like, no, no.
Maybe somebody knows it. Infliximab neutralizes the effect of what cytokine
Oh my God.
to decrease inflammation?
Oh my
Okay,
God.
that took you like 30 milliseconds to
Somebody said
figure out.
IL-2.
Oh, no, it's actually not. It's not, but nobody's going to ask you this on a nursing school exam. I was trying to just mess with Meris, just to be honest. So it actually, yes, there it is, TNF. It neutralizes tumor necrosis factor
Oh my God.
alpha.
The way my heart fell into my butt, I was just like, I wrote the farm questions. I was like, I did not write that.
You're like, I thought I was waiting for like a little bit of panic. I was waiting for some like payoff for that. Like, and she's like, that is not a real question.
She said it with such a straight face too.
I did. I was practicing on the way over in my car. Like we were driving over here. I'm like, infliximab neutralizes the activity of what cytokine, resulting in
Oh my
decreased
God.
inflammation. The problem is that I lie. I am not a good liar at all. Like I suck
Oh my God.
at my
That
face.
was so funny though.
Okay. All right. So, all right. Here's a legit question now. Okay, you ready? Okay. It's not about it's not about infliximab. But anyway. All right. It is a 3-point respiratory
Ooh,
question.
okay.
A patient has a serum theophylline level of 22 micrograms per milliliter. What should the nurse do when the next dose is due?
Okay. Serum theophylline level. This means you got to know what the therapeutic range of theophylline is. This is and that's how they'll get you on like NCLEX and stuff too, is it's a 2-part question. You got to know what the range is, and then you got to know, is that below, within, or above the range? So yes, hold the medication. Yes.
Yep.
100%.
And so give us the therapeutic range for theophylline.
Yep.
You don't have to put the units of measure. Just give us the numbers. Because,
But yes, if you are taught a therapeutic range, you got to know it. It is going to be on that exam.
Totally.
The things that there's only like 10 or something like that you have to.
There's not a ton of them.
Yeah, there's like 6 or 10.
Digoxin,
Phenytoin, theophylline. Oh my God, Meris.
Well, I mean, you got to know your APTT stuff, like heparin and warfarin and stuff. INR. There's another one.
There's another one that I can think of. Yes, 10 to 20. Yes.
Very good.
Yeah. So smart.
10 to 20. Definitely an important range to remember. So good job.
And if you have our nursing school planner, we have them listed in the reference section because your girl was really sick and tired of looking them up in nursing school.
Totally. Everything you need is in the back of that planner, like all the reference stuff for like every one of your classes.
All of that stuff. Yep. Lithium, dig. Yep.
Totally. Should we? Oh man, I didn't even come up with any ridiculous things for people to put in the comments to try to win Nurse Squad. Hold on. Maybe I did, like my previous self did it, and I just no, I don't have anything. Okay.
We gotta do something like Miami themed,
right?
Like cruise themed.
Right. Nurse Squad in Miami.
Okay.
Yes. Okay. So if you would like to win a Nurse Squad game of your choice, then Nurse Squad, put in the comments, and you have to put it exactly. Oh, and before I tell you, you only enter one time.
Angelina will come through the screen.
Yes.
And she will destroy your entry if you put it in more than one time.
All right.
One time.
Nurse Squad in Miami. Nurse Squad in Miami. And put that in the comments, and then we will enter you to win, and then we'll give Angelina 5 minutes or so to make sure my phone so that she can. Okay, you got it. And then we'll give her about 5 minutes to pick a winner.
Yep.
And then we'll pick another winner towards the end. So Nurse Squad in Miami.
Yes.
Nice. All right.
You guys are killing it.
For sure. Okay. I think it's our turn to answer, isn't it?
It is. And this is a 2-point endocrine section.
Okay. You guys.
Sorry, my brain stopped working.
All right. Team Cathy. So A through L, this is our moment to answer this question.
Okay. Propylthiouracil is indicated for the treatment of which condition? And I'll tell you that there's 2 possible answers here.
All right. But there's one like pretty basic answer.
Yeah, but it could be like this or that.
Oh, yeah. Okay. All right. PTU. Propylthiouracil. So we have a cool chicken hint to help you remember what this medication is for. So if you have our pharmacology deck, there it is. Nice job, Ariana. It's for hyperthyroidism.
Yep.
So PTU prevents thyroid levels from being up too high. So when you have hyperthyroidism, PTU is a treatment for that.
Yep.
So, which includes Graves' disease. So
you didn't tell us the acetylcysteine.
Oh, acetylcysteine smells like it smells like booty. Except for it's, I don't know. I feel like sometimes I just want to say the word, but I feel like I'm going to get in trouble.
It's Bill that's going to get us in trouble.
I know. Or some nursing school might be like, we have a lot of nursing programs that use our videos and stuff and like, like use us in the classroom, promote us to students. And I'm afraid that some of those.
My thing is that if you're in school to be a nurse, then you are by definition over the age of 18. So
and you're gonna hear all the words in the acute care setting. I mean,
the stories I could tell you of the things ER patients have called me. I mean, I'm like, oh, that's a new one.
Oh, girl, no. I remember this one patient who I had to do a wound vac on, like a really big stage 4 on his booty. So I had to like convince this patient to turn over too. And he used to call everybody and F this and that and everything. And he would totally like cuss at me too. And he would throw his food. He'd like throw like his salmon and quinoa all
That's
over the
the
floor.
worst.
I know.
Salmon and quinoa.
Seriously. And I had to get
Sorry,
into-
I can't relate. I'm an Ohio nurse.
Your bougie California hospital. you
I
do
know.
salmon
We
and
have
quinoa?
salmon and quinoa. Do you guys not see our serve?
We sell like 3-day-old meatloaf.
Anyway, and I'm like, I look in the room and there's like quinoa and salmon all over the floor. And I'm like, I gotta get this wound vac done. So I go and get myself a bunch of towels and I lay a trail of towels to his bed. And then I promise him I'm gonna scratch his back because his back's always itchy if he would cooperate and just turn over for me and let me do this wound
Oh
vac.
my God.
Do we have a winner?
Yes, and you're gonna make me do it.
I am. It's good to be the boss sometimes.
We have our nurse squad winner.
Yes.
Okay, our nurse squad winner in Miami is Joya Zucchero. So if that is you, who I just saw a comment right here, email us at support@leveluprn.com.
Congratulations.
Yay!
Congratulations. This is her. Is this a Bay Area patient? No, it's San Diego though. I want to go to California and get sick now.
Literally, I'm like, dang. Next time I need medical attention, I'm hopping on a plane.
Totally. You know, I mean, yeah, it's okay. It's all right. So yeah, salmon and quinoa. I guess that's so funny. I never even thought about that. That's like a regular thing they serve at our hospital. All right. So that was who did last? I'm sorry, we're having too
I
much
don't even know
fun.
what's
And
going
who asked the last question?
You ask me now.
Okay. So all
You
right.
answer that one.
All right, you have so Team Meris, if you're M through Z, this is a Pharm Basics question. It is 3 points. Okay. Oh, this should be a 3-point question. Well, you guys have this. You have this, but what are 4 symptoms that may demonstrate that a patient is experiencing fluid overload during an IV infusion? 4 different things. And
this is so easy.
go.
This is so straightforward. Don't overthink this. It has nothing to do with pharmacology, really. It has to do with what are the symptoms of fluid volume excess.
4 things, and you got 1 minute. So take your time.
Just start
time.
rattling them off.
Or we could just chat about stuff like anything. Like,
You can do this. Fluid volume overload.
mojitos tonight.
Too much
Mojitos.
volume in the pipes.
Oh, crackles. That's 1.
Crackles in the lungs. Yep.
Okay.
Edema. Yep.
Okay. There's edema. You need 2 more.
2 more. I believe in you. Tachycardia. Dyspnea.
There it is. You got it.
Yes.
Nice job. Nice
Good.
job.
Yes. Fluid volume overload and fluid volume deficit, but I really feel like overload is like you got to know about it when it comes to NCLEX. It's like one fluid, electrolytes, acid base. Like you have
Totally.
to know.
Let me ask you all a follow-up question though. If a patient has fluid volume overload when you are administering IV fluids, do you need to discontinue the infusion? What is something you can do to help address that situation?
That's a good question.
Right? Because there's so many IV complications that you do need to discontinue the IV infusion right away.
Yeah.
And, but
Now, obviously, if your patient is having respiratory distress, like if they're like dyspnea, like, orthopnea, they're leaning over the thing, like then sure, turn it off and call the doctor.
Yes.
But otherwise, yeah,
you can
slow it.
Yep, you can slow the rate.
Yeah.
So
And I'll tell you too, this is something that in the ER, we give fluids to everyone, right?
Yeah.
Like you walk in the door, you get a CT scan and a bag of fluids. Like
Yeah.
it's the rule. But people who are at risk for fluid volume overload, patients with cardiac, heart failure, previous fluid overload, anybody who's got like ascites, they really do pay attention and we're very judicious with our fluids when it comes to being at risk for fluid volume overload because it can be so dangerous.
totally.
So yeah, this is like you've got to be able to identify it.
Right. And this goes for like blood transfusions too. So we have kind of circulatory overload when you're
Yes.
doing a blood transfusion. And often you can slow the rate, possibly give diuretics. and keep the infusion going.
Yeah.
So
It's only like the true reactions, like hives, difficulty breathing, that kind of thing where it's like, oh, we've got to stop it. But yeah,
totally
if they're just like uncomfortable.
nice.
Slow down.
You guys are doing so
I know.
good.
You guys are so smart.
Totally. All right. Team Cathy's turn.
2-point gastrointestinal system.
All right, here we go.
Oh, this one's easy, but it's a good one. I like this one. Which laxative is also used to treat hepatic encephalopathy?
All right. Yep. So this is a laxative. It's used. Can I talk about what it does? Like its mode of action and stuff?
I'm
not giving the name. I'm not giving the name.
I feel like you are giving the name though.
Well, it doesn't. So when someone has liver disease.
Oh, there.
Oh, well, there it is. Okay. So I didn't even need to give you my hints. Okay. So when a patient has like hepatic encephalopathy, that is caused by too much ammonia and in the brain. It's collecting there and it's causing confusion and issues. So lactulose, which there's a couple different ways to pronounce it. I actually spent a lot of time online, like trying not to mess this name up. Anyway, but lactulose, I think, is like the way you pronounce this, or at least a way to pronounce it. Yeah. It helps to get rid of excess ammonia. So it helps you to excrete ammonia to help treat that hepatic encephalopathy. So.
Yes. And pro tip, if you believe that your patient might be suffering from hepatic encephalopathy, like if they come in the ER, if you're working in the ER, grab a second lavender top tube because it has to be on ice in order to check the ammonia levels.
Really?
Yes. So my biggest pet peeve,
the ER nurse.
If you come in with altered mental status, I'm getting a blood sugar right away and I'm drawing that ammonia because a lot of people have this. A lot of people have it. And even if they say that they don't drink and things like that, we've got to just assume and check. And they're always a hard stick. And then you are stuck going, I don't have enough blood.
Well, and when they come up to the med surg floor then and they're on lactulose, get ready for them to poop like 10 times a day, right?
So much.
They poop like all day long.
And it's like explosive. Yeah.
It's a lot of loose poop. So just be ready for that. Have lots of chucks in the room if they're incontinent or semi-incontinent, you know.
Oh my God.
Anyway, I do remember my patients.
Yeah, because that's how they lose their ammonia is through their butts.
Through their butts, yes. In fact, I just heard cool chicken. Lactulose helps you lose ammonia in your stool.
Yeah.
So, all right.
We said it a little bit nicer. Yeah. Out your butt.
Whatever. Y'all get that. It's fine. It's fine. We can say butt here. It's fine. We're not. It's fine. Okay. Was that was us? We got that. Okay. So you guys ready?
Yes.
This is a 3 point.
I know. I just saw your train of thought.
I'm thinking maybe we. Well, no. I decide, right? Like right now, we could play a hazard card on you, right? No, it's your turn.
No, I could play a hazard card on you.
Maybe you want to do that?
It's super weird how I've decided to play a hazard card all of a sudden.
Great minds think alike.
So this hazard card, like I said, my favorite, this is order clarification. It says your patient's orders are confusing and you need clarification. So a call to the prescriber is in order. Unfortunately for you, doctor never answers a page is working today, so you might be waiting for a while. And there's like 3 doctors that come to mind right away because, man, you will know the ones that it's like, I've paged you 15 times, man.
Oh, okay. So here's how this works, Team Cathy. If we don't answer this question correctly in the 1 minute, then we lose 4 points.
Yes.
But if we do answer it correctly, we don't get any points, but we don't lose any points either.
So the reason that we were thinking of playing a hazard card is because this is a 3-point question. So it's more difficult. I'm not going to waste my time playing it on a 1-point question when it's like, I'm almost positive you're going to be able to answer that. But if we're playing one-on-one and I know like endocrine is Cathy's weak spot or nervous or whatever, and then I see that 3-pointer come up in that section, ooh, I'm going to go for that, right? So there's some strategy involved in it too.
Right. When you're playing competitively, right?
Yes.
Okay. So Team Cathy, A through L, get ready. We got to get this one right. Okay,
here we go. 1 minute on the clock. Name 3 symptoms associated with an acute hemolytic transfusion reaction.
Okay, so we're having an acute hemolytic transfusion reaction, and we were talking about transfusion reactions before, but this is the big one. And this is you will totally get tested on this in nursing school. So you got to know these symptoms. Give me some symptoms, guys. We need 3.
Back pain.
Yep.
So hives are a sign of a different reaction.
It's not hives.
Fever.
Okay, we got 2.
And yes, increased respirations. Yep.
Nice.
Yes. So acute hemolytic transfusion reaction, low back pain is like, that's the big, like that's when you hear low back pain
You're
and
like,
blood transfusion, hemolytic transfusion reaction. Fever or chills, tachycardia, hypotension, and tachypnea are the big ones.
Yep.
Yeah.
All right. So follow-up question, guys. If your patient is having this type of reaction, what do we need to do? What are the things we need to do?
Because there's more than just the first step.
There's several steps.
Yes. And this you will get tested
and you'll get
on.
tested on this. So, okay, our patient is having an acute hemolytic reaction. What do we need to do as the nurse?
Stop the infusion.
Yep.
And then what?
And then what?
Yep.
Okay. What are we doing after we stop the infusion? And give normal saline.
Yep.
How specifically are we? Because you set up the blood transfusion set with normal saline.
Change tubing. Yep.
Yeah, we're going to change the tubing. We would not give the normal saline through that blood tubing because guess what? All that blood would go through.
Send the blood back.
Yes.
This is my pet peeve on transfusion reactions. People will just like kind of get caught up in the like caring for the patient. You need to send, and there's usually blood bags usually have little things at the bottom that are like to be sent back if something goes wrong, essentially. And you send it to the blood bank so that they can make sure, was this mislabeled? Did we get the wrong blood type? Did it have antibodies that my patient has, antigens? My patient has antibodies.
This is a severe reaction. Yeah. So they need to get to the bottom of it. But just to be clear, we are giving normal saline through a separate line.
Don't flush it through.
Don't flush it through because guess what's in that tubing still is blood.
A lot of blood.
A lot of blood. So if your patient's like flipping out, having this reaction, we don't want more blood in them. So it needs to be given through a separate line, and then we need to give the blood back.
Yep, exactly.
Nice job. Nice job.
I'm gonna set this aside because you got it right, but you didn't get points.
Okay, that's true. That's true. Okay, now that was your turn, right?
It was our turn to answer a question,
and you did the hazard. So now it's our turn to answer a question.
Sure.
All right.
I straight up don't know.
That's the problem. When we get together, we get kind of silly. Like we start having fun and we silly, and we just like
it's a little bit of a problem.
Okay.
Okay. The nurse should educate patients to do what after administration of an inhaled glucocorticoid.
Okay, so after a patient has had an inhaled glucocorticoid, what do they need to do after administration? Super important. We only give you the really important stuff in this game.
With every question,
I know,
super important.
It is because that's kind of how we built this game. Was like all the super. Yes. Yep. Rinse mouth. What is that? What does that say? The knee mouth? No, rinse mouth though. We got rinse mouth. Yes. Very good.
Rinse out their mouth.
And why? Yes. Why are we rinsing our mouth after an inhaled glucocorticoid?
Why don't I have to do that with albuterol?
Right. So tell us that, guys. Why are we doing that?
Also,
they know.
As someone who takes an inhaled glucocorticoid, I can attest to the fact that I definitely do that every time after I take my medicine.
Yes, you can end up with thrush, which is a fungal infection in your mouth.
Because remember, corticosteroids increase your risk for infection, and if the corticosteroids, these are usually dry powder inhalers, and so they stick to the moist environment of your mouth. Versus like albuterol is like an aerosolized like vapor,
Right.
So it's going to go down into your lungs. And I mean, the other one is too, but it's going to stick to the wetness of your mouth as well. And then you're going to end up with that imbalance of your normal flora.
Yeah. Totally. Yep. Yeah. And so my mom was taking her asthma medication, which had a glucocorticoid. Mm-hmm. She initially was not taking it with a spacer, and I was watching her take. I'm like, you're just spraying that into your mouth, Mom. You're like literally just spraying it, right? Like, and I was trying to coach her on like, and it's hard. It's not easy to press for a lot of patients. Not easy to press and inhale such that you're not just depositing it in your mouth. So I told him like, get a spacer, and that way it's easy to inhale it down your lungs and you're not like just sticking it
And
straight in
then
your mouth.
if it is a dry powder inhaler, it's one of the ones where you can't use a spacer. And so
Yeah.
it's breath actuated. Like you have to, and then that's how it works. So then it's just going directly in your mouth. And yes, but nobody uses a spacer and they all should.
I
and it's
love
a whole thing.
spacers. I
Yeah.
think spacers are great. And I try to, but it's funny. Like some farm people don't like prescribe a spacer.
No, I
Why don't they do
literally,
that? I
So-
love spacers.
a nurse I work with was like, Meris, I was doing patient education for a patient I was discharging with an inhaler, and I went and I pulled up your TikTok about using your inhaler, and she goes, and you talk about using a spacer, but you didn't use a spacer. And I was like, it's because I don't have one.
Yeah.
I was like, nobody has ever given me a spacer.
They're not easy
ever.
to get.
Yeah. And then she was like, well, I'm going to get you a spacer. The next time I saw her at work, she was like, here's your spacer,
Oh,
man.
good. You have a spacer now. Yay.
But yeah, nobody gives them. You have to like ask for them. It's a whole thing. Yeah.
Wow.
I don't get it.
Okay. So was that my question or your question?
I asked you that.
Okay.
Yes.
And so did you, okay, right here.
Yeah.
Got it. Sorry. Now it's your turn. All right. 1 point. Respiratory. I know we go on these tangents. I'm
I
like,
know.
okay, whose turn is it?
Yeah. This is a
So,
mess.
all right. I hope you guys are having fun. Are you guys learning a lot? Definitely let us know in the comments. And if this is helpful, if this is a helpful review, be sure to hit that like button.
That's right. Because Angelina won't let us give away the second nurse squad
That
unless
is
there's
true.
enough likes. So she will hold it hostage. So please like the video.
Totally. Okay. This is a 1 point respiratory system. Okay. The nurse is preparing to administer an antitussive. What is this used to treat?
Oh, this has a lot to do with understanding your medical terminology, your root words.
Mhm.
Because if you know what tuss means, if you speak Spanish, you definitely can figure it out. Antitussive.
What's that used to treat?
There's-
Yes,
okay.
Cody. It's
I was like,
used to
there's-
treat a cough.
Yes.
And give us some examples of antitussives. Do you guys know some antitussive agents?
You should if you know our cool chicken.
Yeah. Because we have I'll even tell you A, B, C, D, right?
Yep.
Antitussives include something that starts with a B, something that starts with a C, something that starts with a D. And if you're loving these hints, then you definitely need to get our pharmacology flashcards because
Yeah.
we have all these hints on our
So
flashcards.
many.
Yeah.
Some that I can't even like remember. You'll be like, we have a cool chicken. I'm like, oh my God, we
Right.
do.
Okay.
So
It's a
guaifenesin,
little different.
yeah, is more of a mucolytic, expectorant. So it's actually going to promote coughing because
Yeah.
it helps to break up
Kind
the
of
mucus.
thin the secretions, help them get
Robitussin is because it has
what? You got to know your generic names, right?
Benzonatate.
Yep,
Yes,
that's
absolutely.
one.
Yep.
Remember, we have so antitussives include our B, C, D. What are our C and D now?
The one that starts with a C is a scheduled medication. It's
Mhm.
a controlled medication, if that helps.
What's an antitussive that starts with C that's a controlled med?
Benzonatate is the brand name is Tessalon pearls.
Right.
So those are those like tiny small pearls
Mhm.
that always look like such a choking hazard to me. Honestly, my patients are always like just throwing them back. I'm like, oh God. But yes, it works great.
All right. So give us the C or D, guys. What's an antitussive?
Oh,
Oh,
up here,
codeine.
codeine.
Yep,
we
here it
missed
comes. And then do we have our D?
Yeah, I don't
Kind
actually
of.
see it.
There's that, but that doesn't look like it's. I'm
Uh,
not sure what that is. Anyway,
Dextromethorphan. Yes.
there we go. There we go.
Yes, we
Nice
got it.
job.
You guys are so smart.
Totally. Okay, so that was our.
Yes, we totally missed it. I saw codeine, but I misread it as something else. Somebody said there were all these coughs in the comment, and then somebody wrote codeine.
Okay,
and I
got
missed
it. And we
I'm
missed it.
sorry. My
All right.
bad.
But you guys did great with the follow-up question. So that's our A, B, C, D. So that's how you can remember your antitussive. So
And tos, T-O-S is cough in Spanish. Tussive, antitussive.
yes,
Yeah, see? There you go.
totally. So how about we have people enter for our second giveaway,
Good call.
and then we'll play a couple more rounds
Yeah.
while Angelina is pulling. Okay, so that's yours. She like, give me my card.
Yes, and
So I
Angelina
put it in my
also,
stack.
she messaged and said, if you have any pictures of you playing the game or the character that you identify with, like we want to see it. So send it to us. You can send it to us on social. You can email us at support@leveluprn.com. Send us your pictures of you playing the game, or, even if you're just reviewing by yourself, we want to see it and we can feature you on social. So yeah. So we're not just playing by ourselves.
So what's another Miami themed or just the fact that we're live together, because you're not going to
I
see this
know.
again for a while, probably.
It should be nurse squad twinning is what it should be.
Oh, I love it. Okay, so if you want to enter to win our second giveaway, in the comments, one time only, nurse squad twinning.
Okay.
Nurse squad twinning.
And just for you, I'm going to pull some cardiovascular ones. There was a request for some cardio.
Oh, okay.
ones.
All right, let's move it up there.
Yeah, let's see.
There's a lot of them. I don't know how. There's another one.
I know. Are any of these? These are all 1 point.
Are you looking? You may look down here
Yeah.
at the end of the
There's some
endocrine,
2
gastro,
point.
endocrine. Nope.
Hey, there's 2 points.
You got a few?
Yeah.
Okay.
know.
I did mix these. Gastro, muscular. Okay. Yeah. Do you have some in the
I got
top there?
some, yeah.
Okay. Awesome.
There we go.
All right.
Nurse squad twinning.
All right. Let's see. I'm asking you guys now.
No.
How are we not keeping track of
We're
who's
just really bad at this.
I think we're just really excited because we're excited to be doing this together
Dude,
live.
You guys don't even know. Even when we do see each other, it's for like
It's not long.
it's like a day or two. The most we have ever spent together was what, like 2.5 days at Ellis's wedding, basically, like kind of. But we're spending like a whole week together.
It's crazy. It's crazy.
I'm so excited.
Totally. But we gotta like pace ourselves because we get really excited and we just really want to party and have so much fun. And then
I am too old to party.
I'm like, and I'm not trying to give Meris pancreatitis, and I'm also not trying. So we gotta like contain ourselves
Yeah.
slightly. Okay.
Look at this.
Thanks to your cram courses and review questions on the membership, I got a 1121 on your exit exam.
Heck yes, you did.
Yes.
That's amazing.
Oh yeah, for sure. For sure. So
oh my gosh.
congratulations. Really, if you watch those cram courses, go through those review questions, you have our flashcards, you are going to do so great in nursing school and so great on your exams.
Yes.
And we're here to help you get through school. So
Yes. And yes, this video will be on our page. All of the previous ones that we've done for when we have done at least one from every single nurse squad game now. So there's at least one for you to watch from all of the subjects.
totally.
So you can go back and watch those, and then all of our other lives where we do plenty of other fun, obnoxious things. So
Yep. Right. But you should get a nurse squad game and like bring it to your clinical. So a lot of groups I met recently at the National Student Nursing Association conference, they bring it with them to clinicals. So like when they're done on the floor and they just want to do a review, or sometimes they're in clinical situations where they don't have enough patients. So then they end up doing a review in lieu of taking care of patients, which that super sucks.
I don't miss clinicals at all. I just got to tell you, like, I just, there's so many students I was with who loved clinicals, and I was like thrilled for them, and I hated it. I just didn't like clinical, and it's because that's not the kind of nurse that I wanted to be. And so I just knew right off the bat that like being on the floor, even when it was specialized, ICU, med surg, OR, I was just like, this isn't for me. So just that, all of that to say, if you also don't love clinicals, it's okay. That's not the only way to be a nurse. I promise you.
Totally. And sometimes you get the nurse who doesn't want a student nurse, and honestly, you just need to make the best of it. You need to make friends with like the people at the nursing station and let them know like, hey, I would love to help with stuff. So if you need anything, I'll get a warm blanket, I'll get a water. And guess what? When you do those things at clinical, when opportunities arise to like start an IV or do a tube feeding or whatever, then they're like, ask her. She's been helping me all morning with that. So just make the most of it. And I've heard you like give the advice before about like, you just need to set your expectations correctly for clinicals. Because if you're expecting to learn and do everything you need to know to be fully prepared to be a nurse, that's not going to be a realistic expectation. You're really going to work on your communication skills, your assessment skills.
Yep. You want to, the point of clinicals is learn how to assess people and learn how to talk to human beings, which I mean, truly though. But yeah, it kills me that there's all these nurses out there who hate having nursing students. Meanwhile, I'm like, I want a student so badly. Like that's the only thing I want in my whole life. And we don't get them in the ER where I work. And I'm like, give me the students.
Oh, I love having students too. It's the best. It's the best. Yeah.
Yeah. I got lucky and I got one who was doing a preceptorship up on the floor, and she wants to be an ER nurse, and her preceptor arranged for her to come shadow me for a day. And it was like the most fun. And I was like, I want students every shift.
Totally. Okay. So
Okay.
All right. Is this for us? Team
Yes.
Cathy.
This
Okay,
is
Team
a
Cathy.
Cardiovascular med by request, 2 point. And this one, a bunch of y'all are going to get cocky in the comments thinking you know it. And I'm telling you, this is tricky.
It's a tricky
And
question.
it shows up a lot, okay? When should a patient taking nitroglycerin for chest pain call 911? What is the timing of that?
This is very specific and very important to know.
Yep. Timing. Very specific timing.
Okay. So when a patient's having chest pain, what do they do first when it comes to nitroglycerin? Okay, we gotta be really specific.
Give me a little bit more.
You're gonna have to, like, it's gonna be a longer comment you're gonna have to put in there.
Nope.
Nope,
Nope.
it's not.
When should a patient taking nitroglycerin for chest pain call 911?
After the first dose, if it doesn't work.
Here we go. Yes, this is what I would say is the best answer. If pain continues 5 minutes after the first dose. So yes, you can take 3 total doses of your home nitro 5 minutes apart. However, I sit down and rest first, right? And this is the drag and drop question.
Listen to this. This is you're gonna have to put this in order. So y'all listen up. Okay, here it goes. All right.
I'm having chest pain. I sit down and rest. Now I take my first sublingual nitro. 5 minutes later, my chest still hurts. I call 911.
That's when you do it.
And then take my second one. And 5 minutes later, I take my third while 911 is en route. Okay.
Totally.
So yes, very, very, very important. Yes.
Nice.
So the answer on the card is if they experience no relief of chest pain 5 minutes after taking the first dose. Okay. It's a great drag and drop question.
Oh yeah. And you'll get it.
Yeah.
For sure.
Yep.
Okay. And somewhere along the line, you will get that question.
Guaranteed.
All right. So how are we doing on, because we gotta, does Angelina have our next winner?
Oh, I haven't even paid attention.
1, 2, 3, 4, 5, 6, 7.
I only have 6.
Because the one over there.
No, but that was yours.
Oh, so I need to answer.
So ask us one.
Okay, one more. All right, you check and see if Angelina's got a winner. Well, I asked a cardiovascular system question for 2 points. Okay, you guys ready? At what time of day should the nurse expect to administer atorvastatin?
Okay, listen, I'm going to die on this hill because the answer to this question is not how it is done in practice, and it kills me in my soul every second of every day.
But you're going to get asked this question.
When in NCLEX world, do we give atorvastatin?
But I take it at this time.
You should, but they don't put the order in. They put the order in for, yes, correct. Well, I mean,
yes, it's night. Yeah,
nighttime.
It's with the evening meal at night. I take my statin at night.
So this is the hill I will die on. I don't know if this is my facility or what, but every time I have a boarded patient and we are giving them a statin, like atorvastatin, it's always like 8 or 9 a.m. that it's scheduled. And I'm always like,
oh, they do it at night at my hospital.
What the heck? It is every doctor, every patient at my hospital. And I'm always like,
didn't you call them out on some other thing they were doing? So call them out on this. Girl, go after them. If anyone's going to get them to change it, it's you. Yeah, girls, go after them. Yeah, I take my statin at night. Okay.
No more. Oh.
What? We don't let that. No more lie. Oh, man. Angelina's only half the people watching have liked the video. Okay. So y'all like the video and then we'll announce our winner. Okay.
Yeah. Angelina said we can't do any more lives from the road if we don't get more likes.
So does that include the bar, Angelina? Can we do it from the restaurant? Okay. At bedtime. Yep. Okay.
At bedtime, you guys are so good.
I know, for sure. So so make sure to like this video and should we add up our points? Yep. So first of all, 1, 2, 3, 4, 5, 6, 7.
Yes.
Okay. All right. So
oh, great question, Cody. Oh, us too.
14.
So Cody, the reason that you should give a statin at night, statins are given to reduce cholesterol, and cholesterol is synthesized in the liver at night. So that's the rationale behind giving it after the evening meal.
So you have 14 too?
14 points. Yep.
Oh, I guess we're going to do a tiebreaker. Okay, so here's how the tiebreaker works. At least that's how we did it last time. Mm-hmm. We asked the question, and then the first person to answer correctly, whoever's team they're on, that's the team that wins. Oh God! So when someone from A through L answers,
wow!
teasing.
Wow.
But this is a speed game, okay? This is like you got to get in there and get your comment going, and
Yes.
that's who wins, okay?
And like this video too, so that Angelina will tell us who won.
Who won? Okay. So this is the last question of the evening, and it's our tiebreaker, okay? It's a 2-point immune system. Gentamicin is known to cause which 2 toxicities? 2. Put them both in the comment.
Oh my
All right,
God.
come on, Team Cathy. 2 key toxicities caused by gentamicin. You got this.
Oh my God, Team Meris. I'm begging you. I need this win. Whoa.
Yep. Okay, who is that?
I have no idea. What's going on here?
Okay, who is first?
Wait.
Okay, so we had
Yeah. Sorry. There's like
so many
things
comments.
are
All right, we
happening.
got to figure out who won here. So somebody with an A answered the first,
Okay.
and someone with a D answered.
Team Meris, you know, I
Yes.
just listen. And I'm the one with the hint for gentamicin. That gentamicin sounds like geriatric, and when you're old, you can't hear and your kidneys suck.
We have the other hint too. Like
what is it?
it's like gentamicin is the opposite
Oh, yeah.
of gentle.
Yeah, it's
Causes
it's a
nephrotoxicity auto.
really rough one.
And Team Cathy, yes.
Congratulations, Team Cathy, on your win.
Crowd. I don't have my so guys, I don't have my trophy, but I bought a trophy for us, Team Cathy. I bought a trophy, and next time we get together when I'm home, sad, then I will show you our trophy. Like we'll celebrate our win with the trophy at the beginning of next Nurse Squad. Okay. I'm sorry, I'm being ridiculous, but
No, you're
I'm
fine.
excited that we won. Okay. Good job, everybody, though. Okay, let's announce our winner.
Okay, our winner.
Second winner right here. Oh boy. Sylphice?
Sure.
Okay. Our second winner is, and we're probably totally messing this up, so I'll just say it so that I always mess stuff up anyway. Sylphis? SP. Sorry. SILFISE.
Okay.
P. And Mary's going to put in the
I'm gonna
comments.
It was this one. No, that's not the thing.
Let me move this out of the way. There. Is that easier?
Why am I so bad at this? Oh my gosh. Okay, these were our 2 winners from throughout the evening or afternoon, whatever it is. I wouldn't
At
even
your
know.
time.
Yes. So email Angelina at support@leveluprn.com. Let her know which one of our lovely Nurse Squad games you would like, and she'll get you the hookup.
Yep. And we'll send it out, and you will have so much fun playing it, and you'll be learning a ton and be ready for your exams. So it'll be awesome.
And listen to me, if you are not following us on social media, you need to immediately, because we are together, which means that there will be nonstop posting. I am going to bully my husband into taking as many videos and pictures of us as possible. I fully intend on blowing up our social accounts. So make sure you're following so that I can take you to the gun show.
Okay. All right. So, okay, guys, it was so fun tonight. I hope you found it helpful. We're going to do this again in a couple weeks. I don't think we have a date yet.
We
though.
haven't picked a date yet because we've got some craziness going on in the next couple of weeks in terms of our schedules. Don't forget though, if you've got pictures playing Nurse Squad by yourself with your friends, whatever, we want to see them. It makes us so happy. Whenever they come in, they send them to the whole team, and we just get like,
Totally.
like it's so cool to see this thing that we worked on and put our our hearts and our love into, and to see you guys enjoying it. It really is a huge reward for us. So we love to see pictures of you playing it, and then we can feature you on social media too.
That's awesome. That's awesome. Well, good luck with all of your exams coming up. I know you guys have some exams right around the corner. We're here for you. Definitely check out our resources, our flashcards, our membership, our videos. Like we have all the things to help you get through it. Okay.
So much stuff. Yeah.
Totally. Well, have a great evening. Thank you so much for joining us.
Bye, friends. Have a
Bye.
great rest of your Sunday.